Hello, this is Luis. Welcome to the HDTV updates from the 58th EASD annual meeting. Today we bring you the Day 1 updates of EASD 2022. To date, Digimed presented a session on the effects of 5 weeks of once-daily dapagliflozin treatment on skeletal muscle fat metabolism in type 2 diabetes patients. It was observed that dapagliflozin induces a change in skeletal muscle substrate metabolism, favoring fatty acid oxidation and a decreased glycolytic flux without affecting mitochondrial function or mitochondrial LD interaction. In an intriguing session, Ku revealed that glomerular hyperfiltration was linked to the development of NAFLD and the advancement of fibrosis in relatively healthy young individuals. Glomerular hyperfiltration may be utilized as a clinical surrogate diagnostic for the early detection of NAFLD in people without diabetes, regardless of obesity, insulin resistance, or hypertension. Rossing addressed a session in which the findings of SUSTAIN-6 and PIONEER-6 post-hoc analysis indicated that the risk of MACE was higher for individuals with impaired renal function than for those with normal kidney function. Semaglutide consistently reduced MACE risk across all eGFR and UACR subgroups. These data suggest that semaglutide has cardiovascular advantages in people with T2D and high CV risk over a broad range of kidney function and impairment. Velan demonstrated that dapagliflozin treatment for 2 weeks in adults with prediabetes enhances 24-hour and nocturnal fat oxidation, has substantial impacts on 24-hour glucose and free fatty acid levels, and has a significant influence on nocturnal beta-hydroxybutyrate levels. Furthermore, dapagliflozin increased ex vivo mitochondrial oxidative capacity in skeletal muscle. These findings indicate that dapagliflozin induces metabolic health benefits in prediabetes patients that may resemble the effects of calorie restriction. Botan demonstrated that fully closed-loop insulin administration improves glucose control without increasing the risk of hypoglycemia in people with T2D in an open-label, single-center randomized crossover experiment. In this case, the medication may constitute a safe and effective approach of achieving the glycemic target. Krasowskate presented data from the Edinburgh Type 2 Diabetes Study, which found that the amino acid phenylalanine was linked to incident CKD in people with type 2 diabetes, but it did not enhance an existing risk-response prediction model. Kasparova conducted a complex metabolic analysis of subcutaneous and epicardial adipose tissue from heart failure patients treated with an SGLT2 inhibitor to analyze their influence on various fat depots and find possible cardioprotective elements. The study demonstrated that SGLT2 inhibitor treatment elicits distinct metabolic responses in subcutaneous and epicardial adipose tissue, with subcutaneous adipose tissue exhibiting primarily enhanced ketogenesis and epicardial adipose tissue preserving other functions, including potential cardioprotection. This concludes our coverage of the HDTV updates for Day 1 of the EASD 2022. We'll meet again tomorrow. Have a good day. Hello, this is Luis. Welcome to the HDTV updates from the 58th EASD 2022 annual meeting. Today we bring you the Day 2 updates of EASD 2022. Amanda gave a presentation today on the UK PDS study, legacy effect, and data up to 44 years of follow-up. According to her, the glycemic legacy effect is actually the hyperglycemic legacy effect. Establishing and maintaining near normal glycemia from the start can reduce the risk of diabetic complications and help one live longer. Early metformin medication appears to lower the risk of complications and extend life expectancy. while near glucose-lowering medicines lessen the risk of some diabetes complications. Maintaining near normal glycemia is critical for reducing the risk of complications to the maximum extent feasible. Patel presented a session that demonstrated that once-daily subcutaneous liraglutide reduced mean anterior thigh muscle fat infiltration compared to placebo in overweight or obese people who did not have diabetes. The significance of improved muscle fat infiltration to the cardiometabolic effects of liraglutide warrants additional investigation. Hansen presented a post-hoc analysis of the priority study, which showed that individuals with normal albuminuric type 2 diabetes and retinopathy had a higher risk of developing albuminuria, but not impaired kidney function, and a significantly higher risk of cardiovascular disease during the 3-year follow-up compared to individuals without retinopathy. Kim delivered a session that examined the relationship between fenofibrate use and diabetic retinopathy development in individuals with type 2 diabetes and metabolic syndrome who were taking statins. In this propensity-weighted cohort analysis of individuals with type 2 diabetes and metabolic syndrome, adding fenofibrate to statins was linked with a considerably decreased risk of diabetic retinopathy development than statin treatment alone. Cordiner examined the prevalence of clinical determinants of severe hypoglycemia in type 2 diabetes patients taking insulin and sulfonylureas. The incidence of severe hypoglycemia linked with sulfonylurea has been observed to be low, more than a third lower than that of insulin. However, certain people are at a significant risk even when treated with sulfonylurea, such as elderly women with long-term diabetes and low HbA1c. Rylestone presented the results of the PACE study, which demonstrated that a CGM device with an urgent low soon alert reduces exposure to level 2 hypoglycemia when compared to real-time continuous glucose monitoring with a threshold alarm. In addition, compared to a threshold alert, an urgent low soon alert decreases exposure to disabling hypoglycemia below 2.8 millimoles per liter in the 24 hours following exercise. These findings imply that people with type 1 diabetes who exercise regularly benefit the most from a predictive alert monitoring system. This concludes our coverage of the HDTV updates for Day 2 of the EASD 2022. We'll meet again tomorrow. Have a good day. Hello, this is Luis. Welcome to the HDTV updates from the 58th EASD 2022 annual meeting. Today we bring you the Day 3 updates of EASD 2022. Cardianis presented a session that investigated whether tirzepatide's beneficial metabolic benefits extend to improvements in patients' lipid profiles. Based on pooled data from RCTs, it was found that tirzepatide therapy reduced triglyceride, total cholesterol, low-density lipoprotein cholesterol, and very low-density lipoprotein cholesterol levels in comparison to placebo. As a result, tirzepatide, in addition to its glucose-lowering impact, might be utilized to improve the atherogenic lipoprotein profile in type 2 diabetes patients by supplementing the effect of lipid-lowering medicines. Wu conducted a trial which compared blood glucose and plasma insulin, glucose-dependent insulinotropic polypeptide, and GLP-1 responses to intraduodenal glucose infusions in healthy young males and females. This trial reported that healthy young females exhibit comparable glucose-dependent insulinotropic polypeptide, but a markedly greater GLP-1 response to small intestinal glucose infusion than males. Leilama presented a session which reported the glucagon responses to weight loss-induced diabetes remission vary extensively. Higher glucagon before intervention is associated with greater decreases of fasting and postprandial glucagon and greater improvements of insulin secretion, while improvements of insulin sensitivity were independent of glucagon dynamics. He further highlighted that diabetes remission may be primarily glucagon dependent in a subgroup of patients, which will be further characterized. Overall, this data supports a protective role of glucagon in early diabetes. Skupelius presented the findings of a study which revealed that under isocaloric conditions, high-fat intake strongly increases basal and postprandial glucagon levels in healthy young subjects. The increased glucagon to insulin ratio suggests a reduced insulin-mediated inhibition of glucagon secretion as one potential mechanism. Nevertheless, the postprandial elevated glucagon levels indicate an additional effect of dietary fat intake, as body weight, liver fat, and insulin resistance showed no clinically relevant increases. The observed rise in glucagon may represent a protective metabolic response to high dietary fat intake, which increases fat oxidation to prevent fatty liver. McGill presented the findings of the Fidelity trial, which focused on cardiorenal outcomes across the entire spectrum of CKD in type 2 diabetes, and found that finerenone reduced CV and kidney risk in a significant and clinically relevant manner. Finerenone also reduced all-cause mortality and CV mortality in an on-treatment analysis. Simikas presented a session titled "Why Do We Need Once-Weekly Insulins?", in which he emphasized the importance of once-weekly medications because they provide greater convenience, better medication adherence, improved health-related quality of life, a less overwhelming sense of treatment, and make it easier for individuals in need of medical assistance. This concludes our coverage of the HDTV updates for Day 3 of the EASD 2022. We'll meet again tomorrow. Have a good day. Hello, this is Luis. Welcome to the HDTV updates from the 58th EASD 2022 annual meeting. Today we bring you the Day 4 updates of EASD 2022. In introducing the new consensus statement, Robert Gabay called it perhaps the best yet. The most recent update to the ADA and EASD Hyperglycemia Management Consensus Report emphasizes holistic, person-centered care for type 2 diabetes patients. Cardiorenal protection, cardiovascular risk factor management, weight management, and blood glucose management are all important components of holistic care. It is worth noting that the statement no longer recommends metformin as the first-line medication for type 2 diabetes, acknowledging that other medications may be more appropriate where there is a strong need to reduce cardiovascular and/or renal risk or lose weight. Busey concluded that we believe that emphatic, person-centered decision-making and support that is informed by an understanding of local resources and individual social determinants of health is essential. Marks led a session in which he emphasized that SGLT2 inhibitors are a novel treatment option for all heart failure patients, diabetic or not, regardless of ejection fraction. SGLT2 inhibitors' beneficial effects are mediated by a number of mechanisms. Despite the exclusion of patients with HFrEF, finerenone reduces hospitalization for heart failure in patients with diabetes and CKD. Londahl presented a session that demonstrated that SGLT2 inhibitors and GLP-1 receptor agonists are associated with lower mortality in younger people with type 2 diabetes and a first myocardial infarction. It was concluded that the use of an SGLT2 inhibitor or a GLP-1 receptor agonist was associated with a lower 5-year mortality rate. Lund concluded during a session at the EASD-ESC Symposium that type 2 diabetes increases the risk of heart failure, particularly HFpEF. Systemic inflammation and microvascular endothelial function are thought to be involved, leading to altered metabolism and cardiac fibrosis, stiffness and impaired relaxation, as well as vascular kidney and multi-organ involvement. These mechanisms may be particularly suited to treatment with SGLT2 inhibitors and emerging agents for type 2 diabetes, obesity, or metabolic syndrome. Savikic led a session that resulted in a comprehensive evaluation of multi-tissue, metabolomic, and skeletal muscle proteomic responses to training at different times of day in men with type 2 diabetes. Morning and afternoon high-intensity interval training were associated with increased circulating lipids and changes in adipose tissue lipid composition. However, afternoon high-intensity training increased skeletal muscle lipids and mitochondrial composition more than morning training. This diurnal component of the metabolomic and proteomic training response may be clinically relevant and warrants further investigation. This concludes our coverage of the HDTV updates for Day 4 of the EASD 2022. We'll meet again next year at EASD 2023.